subscribe now and press the bell icon. Never miss an update.
Hello and welcome to Health Live at Seniors Today. Delighted to have all of you here. And these are the last few weeks of the calendar year. And it's the season when, it's getting cold. I know there's some of you who are in Mumbai may not be feeling so, but the rest of the country, it is getting a little nippy. And we thought it would be appropriate to have a session today on, given the fact that winter is setting in, on winter care for joint pain. And for this, we have invited Dr. B.S. Murthy, who is a senior orthopedic and joint replacement surgeon based in Delhi. I'll introduce Dr. Murthy first. Dr. B.S. Murthy is director and senior consultant, orthopedics and joint replacement at the Dharamshala Narayana Super Speciality Hospital in New Delhi, which is part of the Narayana Health chain of hospitals. He has experience of over 3 decades, 32 years to be precise, in joint replacement surgery, with thousands of knee replacements and hip replacements to his credit. He does most of his primary replacement surgeries using minimal invasive surgery and a computer-assisted navigation system. He's in charge of high-risk and critical cases like major trauma, pelvic fractures, and complex primary and revision joint replacement cases. He has contributed to various national and international journals. He's an MS in orthopedics from Orissa, from the NKHCG College, Medical College in Orissa. He is a fellow of the International College of Surgeons in the US, as well as a fellow in trauma from Germany, a WHO fellow in trauma and from Australia, fellowship, joint replacement and adult reconstruction in Singapore, visiting fellow primary and revision joint replacement from Belgium, visiting fellow minimal invasive hip replacement from Belgium, again, and fellowship from the Association of Osteosynthesis from Switzerland. He has been there with various hospitals, the Max, Fortis, RML in New Delhi, the Central Institute of Orthopedics, which is at Safdarjung, the NKCR. He has been a registrar of rehab at the AIMS in New Delhi, and faculty for joint replacement and various things. We are really very delighted to have Dr. Murthy. How are you, doctor?
Fine, thank you very much. It is a pleasure to be with you all.
Doctor, I have a question which is away from the subject. You have done so many education degrees. How do you manage to do that? So when did you actually decide to start practicing? Because for the first 30 years you must be just studying.
Yeah, it is usually not only me. I think 90% of doctors keep studying till now. Also, I get up at 4:35 and study for 2 hours and then go for exercise. I am also a senior citizen, right? 64, 65. So this talk will also help me in a way. But then it is a motivation because I treat mostly geriatrics, senior citizens for joint replacement. So I understand their psychology, their needs. So I feel very happy about it. And if I can contribute something. As far as education is concerned, it is just an ongoing process for all doctors. Nothing great. Everybody does the same thing.
That's true. Absolutely, doctor. Doctor, tell me something before we, invite you to start speaking. In the field that you are specializing in, which is knee replacement, joint replacement, and you said that you treat essentially geriatric older patients. Do you find that over the years, even there are a fair number of younger patients also who are coming, or is it essentially older people?
Yeah, that's a very fair question because nowadays we are finding a lot of younger patients. Like a lot of articles you have well published that a lot of heart attacks are occurring in younger group. Same thing is happening in younger group. Joints are getting damaged. They're abusing it too much. The bones are not mature. 16, 17-year boys going to gymming and trying to develop good muscles, putting a lot of load because bones are soft at that age. So they are abusing. These boys are working too hard, smoking, drinking, and all substance abuse and tension, night duties. That is putting a lot of stress on their muscles, back pain. I get almost 50% of my practice, young guys, back pain. And I ask them, do you work in a software engineer? He says, yes. I tell them it's a computer disease. Now I'm getting older people also because they become more technically savvy, 60 plus and all, they have nothing else to do. So they get what we used to have is the Blackberry syndrome, that time thumbs used to
Right.
get. Now we are having a lot of computer disease. Their neck pain, cervical pains are too much. They don't sit properly. The posture is bad, and
Right.
that's another matter always. We can
Absolutely,
discuss
doctor.
that.
So you get up at 4:30 at 5, and you are living in a city like Delhi, which gets very cold. In fact, right now it must be fairly pleasant and warm for you in the
Yeah,
city.
it is present. It is still not very cold. It will
Yeah.
become another 1 week, we get it cold. Cold wave will come.
Great, doctor. Over to you for your presentation. Those of you who have questions, I know some of you will want to ask questions on joint replacement, etc., because we have somebody as illustrious as Dr. Murthy in the house. But our first preference will be to for questions around winter health, joint pain, etc. Which so please, as always, put your question in the Q&A tab. Mention your age and your gender so that doctor can give a considered reply, and we will take questions once he's finished his presentation. Over to you, doctor.
Yeah, thank you. Good evening, all, and welcome to this beautiful, wonderful session organized by seniors in today. And the way amount of care they are taking, it's really heart-touching, and I'm very grateful to you for giving me this opportunity to reach out to all the people, senior people, including me. I'm also 64, so I would consider that. So basically, winter care of the joints. If you want to understand, let us divide each into it. What is a joint? Why it pains in the winter? That we must understand first. And then we can, what are the problems? So what are the usual health problems as we discussed earlier today? They usually cardiac problems, a lot of heart attacks occur early in the morning in this age group in this winter seasons. Breathing problem, particularly in Delhi, skin problems, of course, do occur. So these are the various, of which the most important bone and joint problems, which most of us neglect, because it is not a life-threatening problem, whereas breathing and cardiac problems are life-threatening. So we tend to neglect them. And then we get into pain, and then we suffer from it. So how to prevent this? So first, for that, we need to understand what are the factors which aggravate these factor issues. Like person who is very older age group, his bones will be creaking and joints will be causing more problems. And osteoporosis is one of them, osteoarthritis, all of them. Comorbidities, patients having diabetic or hypertension, renal issues, they have more chances of having bones and joint problems. Lifestyles, we are becoming older, but we need to be very young at heart. I climb 9 stairs and studies of building every day. And I am really abusing myself, but then I'm used to it. I get up at 4:30, go for a walk and do studies. So this is working conditions, stress. As a doctors, we really are stressed out till 70, 75. We keep working. We have no retirement age. Certain people do not have retirement age. Nowadays, government services also extended to 65 years. And then they still keep working in different companies. So working conditions are too much. Stress is. We have socio-economic issues like people who are very rich, they are okay, but let us consider those people who are on the roadside and they are seniors and they have joint pain. They do have, they're not nothing. The pains do not see what money status you have. So let us consider what is a normal bone. People think bone is just like a stick. It is not. It is an active, living thing. It is made of cells, proteins, calcium, other minerals. They have nerves, blood supply. And blood, in fact, is made in the bone. So it is the most active. 7 days, within 7 days, your whole blood is changed by the bone. So the joints, it is the two bones meet each other. The muscles surround them. The bone ends are covered with a cartilage cap, which is not having blood supply or any nutrition. It comes from a synovial fluid, which is secreted by the capsular lining called synovium. And this is a very greasy and lubricating substance. And this is stabilized. All bones God has made such a beautiful one, balanced and aligned, is by ligaments and is moved by the muscles controlled by our brain. So this is what a joint is. So now you understood what a joint is. The bone ends are meeting at each other. So there are different types of joint. I will not go into it, but weight-bearing, non-weight-bearing joints we must consider because the pain in the winters differentiate in different areas. We have different diseases like rheumatoid arthritis, uric acid affecting gouty arthritis, skin conditions arthritis, with GI problem arthritis. all of them end stage is the osteoarthritis, where the articular cartilage gets rubbed up, the bone gets exposed, giving rise to pain. So now I believe now you understand why joints arthritis is when the cartilage cap is completely rubbed off, the bones are touching with each other. Like tire is gone, you're walking on the rim, and the rim has got nerves. So when they touch with each other, you get pain. And now I'll go next, why it pains more in the winter. And so in the winter, joint ache and stiffer and painful. This is usually we get most of senior citizen people who come to me, they complain that I'm okay, but in summer I feel very flexible, but in winter I feel I cannot walk, I get a lot of ache, I get stiff, it's pains around the joint. Then I make them understand there are several reasons. So we should understand what is the reason for you to get into pain. So cold makes muscles more tense. So if you are tense muscle, tight muscles, the bones tend to come with each other. Already you're having arthritis, the nerve touch with each other, the pain causes. The nerves, you all know that cold is very sensitive to our skin. So skin nerves become very sensitive to the cold, say, situations. This because there is a decreased blood supply to the skin or other bones and other organs, because in winter, they also go narrowing of the vessels occur. So that's why you say chilblains and gangrene in the cold, very cold areas, because the blood supply to that part is lost. Then it causes death, which is called a gangrene. So you know that it happens in the snowy areas and in mountains. It also happens in the plains called chilblain syndrome, where there is in the cold moment, fingers become blue. So they become, the blood supply to the muscles and other areas become very decreased, and then the nerves become very sensitive. So this is the reason for having this bone and joint pains. So now how to take care of it? So number one position is exercises. So we know now the nerves are very sensitive, the muscles become stiff, the bones are touching with each other. So, and then that causes pain. And blood supply decreases, that causes what we call a necrosis or the lack of blood supply. So this is what we should do. Now, what is the cause? If you maintain your movements by working out regularly, you will have a good movements. Maintain the muscle tone, good movements increases the blood flow to the bones. Yoga and breathing exercises help because the oxygenation to the bone increases by breathing exercises. Yoga mobilizes your joints and muscles. And certain studies, which if you go through the net, that the taking 1 hour of massage every 2 weeks for the duration of winters have good effect. A body massage, oil or no oil, for 1 hour every 2 weeks. This is an important point that I wanted to. Second point in winter care of the joints is keep yourself warm indoors. Take temperature regulations, temperature regulation of the room. That means maintain your temperature between the comfort zone as regulated, desired by the WHO, that is 24 to 26 degrees is the best. It's called ideal temperature. Heating pads, warm water intake. So this will maintain your core temperature more. So take warm water, do not take cold water in the winters. Take warm water because the core temperature is the most important. Core matlab the temperature which is present in our intestine, in our heart, in our body, inside the skin. That temperature is most important one to maintain blood supply to the brain and heart to function. So you must take regular warm water. This is the second point, is that do regular exercises, take warm water. It will not only maintain your hydration, also maintains your core temperature in winter. Proper clothing, layers of clothing like inners and outer wear. That is not that because you are wearing a woolen inner. We know the studied in physics in school that air is a bad conductor of heat. So your heat stays inside. If there is a trap of air in between the two clothing layers. So putting 2 layers of clothing is very important. No doubt winter clothes like woolen clothes and all, they help. But then some people might be allergic. So put on cotton clothes inside, 2-3 layers of cotton clothes. The air gets trapped and that does not cause you to lose heat. Eat right. So a balanced diet is very important. Now, what is a balanced diet? Everybody will ask me, I know. So balanced diet is where you have been prescribed for your calorie requirement, for your weight and height, which is called BMI, your body mass index, height and weight correlation. So that is not that I am like 66 kilos. And if I eat around 5,000 calories, it's not correct for me, right? If I eat 200 grams of protein, my kidney will get damaged. So everybody has got a balanced diet according to. But then WHO has recommended that balanced diet for the bones and joints is the protein and calcium. This is very important. As I told you, the bones are made of proteins, cells, and calcium and other minerals. So this is very important. In the balanced diet, protein is minimum requirement of a protein for an average build of BMI of 22 to 28, that is body mass index. The best is 60 grams of proteins is very important, which comes in 1 calorie of rye dal or 1.5 or 2 eggs, or you can take any other milk or something, then you get this much of proteins. Baki carbohydrate is also recommended, like 100 grams of carbohydrate, 10 grams of fat, minerals, vitamins, all these things are in there. Omega-3 fatty acids, like which are present more in walnuts, you got the dry fruits, salmons, avocado. So this gives rise to your omega-3 fatty acid, which is the most important antioxidant, which is it prevents aging. So this is very important. If you don't have it, you can take it as a dietary supplement available in the syrup form, powder form, or it is available as tablets. You can take it. So important third point, which I wanted to stress is eat right. Then fourth point, maintain hydration. Already I told you, warm water regularly and frequently do give rise to good hydration as well as maintains your core temperature. Now, fifth point, for patients already suffering from arthritis, you will ask me, I got rheumatoid arthritis, I got a gouty arthritis. Do my medication change during winters? They do change. Sometimes when we see the fingers are inflamed with the rheumatoid arthritis or joints are swollen up, we regulate the temperature, we might regulate the treatment. We increase the tighter the dose according to the problem of the patient. So you must go to your orthopedic surgeon or a rheumatologist or a physician who is treating you for your arthritis problem and tell him, winter is coming, मुझे क्या करना बता दो, मेरे को क्या क्या दवाई चेंज करना है तो कर लो, क्योंकि मैं I don't want to suffer in the winter. So we usually, so maybe we might add a little bit of steroids during that period who are having severe pain, or we might modify the drugs to you. So this is taking regular medicines, taking your basic disease, arthritis, rheumatoid or any arthritis. Arthritis means the bone ends are rubbed off, bones are exposed, and the joints become inflamed. So that is arthritis. Now, sixth point, those having knee and hip replacement patients. I know a lot of people will ask me because I do a regular knee replacements around 100, 120 in a month. So we regularly write it down to the patient that these are the precautions. If I do it in winter, they ask me, do I get my replacement done in winter? I heard that it is very painful. I don't think so. Replacements are not contraindicated in Delhi, or which is the most coldest place of all the mega cities. It is not a bad idea to get it done at that time because your stamina increases. And most of the time, I told you stay indoors. But then peak in winters, the skin cut that is been put there is highly sensitive and might cause severe pain. So deep winter, like 1 degree, 2 degrees temperature, I don't think you should go for a knee replacement or a hip replacement because it is an elective surgery. It is a patient demanding surgery. It is not a surgery to be done in emergency. It is like patient wants, we do it. So why hurry? So peak winter, like 1 degree, 3 degrees to 10 degrees in the day, and then the stitcher line will might pain. Your joints become more stiff. So it is not a good idea. But having up to 15, 20 degrees, which is a normal, like I worked in UK and USA where the temperature is 10 to 12 degrees, we do a lot of the replacements because most of the patients are staying indoors, regular post-operative patients. Do regular exercises. So you can get it done in winter, but not in peak winter. End of like around Christmas, you don't get it done. Do regular exercises for those people who had a replacement done. Do not expose the joints to intense cold, neither to heat. That's very important. People say that cold sponging I'll do because post-operative, we say that to decrease the swelling, to decrease the pain sensitiveness, we put a little bit of cold packs. But during winters, when I do a surgery, I say that no need of it. The cold outside itself is a good cold compression for you. But do not expose your joints to the direct heat. Maintain the temperature of the room, but do not sit in front of the heaters or blowers, because there is, in the joint replacement, two metal caps are put on two ends of the bone. Joint is where the two bones meet each other. That is joint. So we are not changing your whole joint in a knee replacement or a hip replacement. We are just putting a articulate cartilage. I told you cartilage gets torn off, the rubbed off, and the bones are exposed. So we need to replace that cartilage cap with the artificial metal cap. But then two metal caps on both sides, they get rubbed off faster, and there are a lot of issues like iron deposition in the body. So what we do is we put a plastic spacer, not only to give a cushioning effect, also to balance and align your knee. Accordingly, we put thickness of the plastic from 9 to 21, 25, 27 degree millimeter thick plastics in between the two. And that plastic is highly cross-linked polyethylene, very costly and highly sophisticated plastic with vitamin E and other antioxidants added to it. So if you sit in front of a heater or a blower, the deformity of that plastic occurs inside, which is not visible outside. So you lose your joint, not in 10 years, 20 years or 30 years, you lose it in 5 years. So do not sit directly. Taking hot water, bath is okay. So I hope you understood all the 6 points that I told you. One is the regular exercises. Second is the diet control, covering yourself, keeping yourself warm, taking good amount of warm waters, and taking regular treatments. And if you have a joint replacement, you should be careful and take your direct consultation with the surgeon who has done it. That's all I say, because prevention is better than cure. It is a saying of 1981 when we were students, finally a student. That time a declaration came that the prevention is the best. So all these social and preventive medicine people concentrated. Now we have got that also in the mind. Thank you very much.
Thank you very much, Doctor. Thank you very much for a very detailed, but not very lengthy presentation, and where you were very clear about what.
I hope all of them, all these participants understood what I was trying to tell.
Yes, Doctor.
I think there are 3 questions, right?
Yeah, there are 3 questions, and there are some more which I've got an SMS. So there's one question from Mr. Shrikant Kulkarni. His question is, for senior citizens used to regular swimming, up to what level of outside temperature can they continue to swim without any adverse effect?
Yeah. So do I type it or I tell you?
Oh, you can speak it out. Yes.
Okay. So this is a very good question which I couldn't tell it because shortage of time. Swimming is a very good exercise, but the temperature has to be normal. In winters, particularly in Delhi, all the swimming pools stop in October and start in April. But then, because that is the time of cold temperature. So I don't recommend normal swimming in a cold, open swimming pool for senior citizens. Not only orthopedic problem, cardiac issues, there are a lot of heart attacks can occur in that. Swimming in a warm indoor pools. Nowadays, a lot of hotels and other people are having indoor pools. Affluent people are having regular indoor pools. Or the pools which have got a temperature regulator inside. It should be warm, should not be hot. Never in the cold swimming. And swimming is the best exercise for anything, for all our bones and joints. I hope that answers you.
Yes,
Don't go for swimming in cold water outside.
Right. But is it only like Delhi weather, Delhi cold, as in what kind of temperature would you think the outside temperature was fair?
40 to 45 degrees is the warm temperature. That is normal temperature. Like the air temperature must be 22 to 26, 24 to 27 degrees. That is what WHO recommended. That is, humidity should be 60%, 22, 4 to 27 degrees of temperature. Air pressure should be certain, which I forgot some pascals. So this is what is recommended. Water, it is like 40, 45 degree of temperature of water is a warm water, and that is the best, which is in the normal temperature everywhere in the world, which is maintained during the summers, the water temperature. So that is the best temperature to go in.
Yeah, but for instance, say in cities like Delhi, it gets down to say 10 to 15 degrees.
Yeah, that is not good. That's not good idea to swim in Delhi.
All right. Thank you, doctor. We have a question from Shamala Ravi. She asks, can we use glucosamine chondroitin sulfate as a prophylaxis to slow down bone and joint?
That's a common question.
Is
This
there
is
a
yeah,
benefit of
that's
the liver
very
on long-term
question.
use?
Yeah. Most of the time people do ask me this question. I love this question because it is a medicine which is useless. In the sense, it is doesn't work much, but it has got a placebo effect. You got a joint pain, patient takes some medication with the doctor writes it very sincerely, take it regularly 2 days, 2 times a day for 3 months. But glucosamine, you tell me, this is a protein which get denatured in your stomach. By the time it reaches your cartilage, it is a cartilage. The glucosamine is the chondroitin and glucosamine sulfate are the proteins present in the cartilage. And cartilage does not have much of blood supply. Much of blood supply. So this cannot, it's not a very effective medicine. But then some people do get relief. Since we don't have any more medicines for the arthritis, we prescribe glucosamine, but it's a very costly medicine. If you are buying it costly, please do not take it. Do regular exercises. There are no medications. Good exercises, like I told you, preventing squatting, cross-leg sitting, stair climbing should be prevented, and do regular muscle tone exercises. As and when you get a pain, severe pain, take some medication. Before that, go for physiotherapy and hot warm temperature fomentations. Medicines like collagen peptides, glucosamine, they don't work, honestly speaking. But some people do get relief. You got injections like lubricants. We inject lubricants, they are effective, but then only in 40% of people they are effective, and that too for 6 months to 1 year. We put into the joint some greasy fluid.
Doctor, I have got a question. I am 65 years old. Sometimes my joints pain, but most of the times it's fine. I'm too scared of going to the doctor because in case he recommends joint replacement surgery or some other invasive therapy. Doctor, what I want to know is at what stage should I approach a doctor even if there are some sporadic joint pains?
Yeah. See, not all joint arthritis patients need a surgery or replacement. Like I told you, there are stages. I wrote in the slide, but I didn't read it. The arthritis passes through 4 stages. One is that the cartilage becomes soft. It's like denting. The softening happens. So while climbing up and down, mostly coming down the stairs where the forces are very high on the knee, it pains. So that stage, nobody will say that you need to go for surgery. You can do good exercises, avoid those where it is aggravating like squatting, cross-leg sitting and stair climbing. You can take glucosamine. It might have an effect on you. So you can take that. You can take at that stage. Stage 2 is where the cartilage is trying to break up, where you have a pain after walking 4 or 5 kilometers. There also you don't need a knee replacement. You have to do good exercises, tone up your muscles, maintain your cycling and other exercises, movements, and take some medications as and when. Go for physiotherapy in stage 2. And you can inject lubricants into your joint because in the X-ray we find a little space decrease. Stage 3 is where you got a little loose, wobbly joint. You are limping. You can walk up to 100 meters. Then you start having pain. But then you are able to walk 4 or 5 kilometers a day in your regular walk and able to do your daily activities. Go to toilet, change your clothes. You are able to handle yourself. And that stage, it is a patient derogative surgery, patient requirement surgery. Patient says, I'm having too much of pain. I want a replacement. So stage 3 is where we leave it to the patient. Stage 4 is completely cartilage is rubbed off. Your bones are exposed. Joint space is completely gone. Your knees are crooked. You're walking with a lurch like this, hardly going to the toilet. And you say that I want to avoid knee replacement, then it is not a good idea. That is the stage. So 3 points. One is the instability, where the joints are wobbly. Second is the deformity. Third comes the pain. We don't operate for pain. We want to make you mobile. That is the reason for doing a knee replacement. And everybody has an idea, knee replacement. I want to take out that myth The knee replacement is not taking out the whole joint and putting a new machine inside. It's a very simple procedure. It's like you can compare your caries tooth, जहाँ पे दांत के अंदर छेद बन गया, उसको साफ करता है, करके डॉक्टर उसको आरसीटी करके उसके अंदर सीमेंट भर के उसके ऊपर कैप लगा देता है. हम भी वही करते हैं, बोन को शेप बनाते हैं स्पेशल इंस्ट्रूमेंट से, आजकल रोबोटिक्स एंड नेविगेशन के साथ करते हैं, उसको साफ करते हैं, हम ही करते हैं. रोबोट्स मतलब हम रोबोट से कराते हैं, वो खाली साफ करने के लिए है. उसका ऊपर थोड़ा सीमेंट भर के दोनों तरफ कैप लगा दे. दैट इज नी रिप्लेसमेंट. इट इज नॉट दैट यू आर टेकिंग आउट योर बोन्स, रिमेन टू यू, your muscles your own, your ligaments your own, everything is your own, only capping the bone ends. So you can walk next day. We make the patient walk next day, go climb stairs in third day, go drive car in 2 weeks, open your stitches, go play golf in 3 weeks. That's what the knee replacement is. It's not a big surgery. It is, for me, today morning I did 7 cases and it takes 15-20 minutes for the person who are doing it regularly. Like changing a tire, we change it so fast. Most of the surgeons who are doing it. So it's not a big surgery.
Changing a tire and knee replacement. That's an interesting.
It's similar. It's similar. Where rim is a bone.
Right. Doctor, we have a question from Suresh Adiari. Mr. Adiari says, for rheumatoid arthritis in particular, any special precautions to be implemented for the winters?
Exactly. It increases, pain increases in winters for rheumatoid patients, becomes terrible, unmanageable. So don't expose yourself to cold at all. Cover up gloves, because hands are mostly affected in rheumatoid arthritis, hands and feet. Double layer of socks. Don't go to those places where the winters are very terrible. Cover your these things. These are the precautions. Do regular exercise, maintain the movement. Every day, 2 to 3 times of warm water, fomentation, maintaining the movement, and changing your medication. You must go to a rheumatologist before the winter starts. This is the most preventive method of doing it.
Doctor, there is a question relevant to what you just implied. Doctor, I take all the possible precautions, including wearing sweaters and jackets. But when I'm going to the washroom in the morning, the water is very cold. Is that harmful?
Yeah, it is harmful. You have got either diabetic or other conditions. So, like I told, chilblain conditions, where the cold water, they cause blue discoloration and all the problems. I think he should consult a doctor.
Right. Thank you, doctor. We have a question from Doctor. Most questions which have come in now are not linked to winter, but I'll ask them because everybody feels comfortable asking them. So there's a question from Katie Daganchi, who asks, is it safe for seniors to take Shelcal tabs to 500 for continuously, or will the right food containing calcium be good enough, as the tablets can damage kidneys in the long run?
Yeah, that's a very good question. People do gulp in a lot of calcium. See, senior citizens market, calcium is not required for everybody. It's not a good medicine. It's not it doesn't get, it gets deposited in the arteries. Your arteries are already stiff. They become, we call it sclerosis. The arteries become stiff. The flexibility of the arteries goes up. Heart attack chances are very high. Calcium channel blockers, you are already taking some medication for blood pressure and all. So calcium should be regulated for senior citizens. For females, it is a postmenopausal hormonal. So for those patients, we give calcium and regulate there. For the normal healthy adult, why should you take excessive calcium? When your blood calcium you have estimated every 6 months. After 60, you should get your blood and everything tested every 6 months. All the cardiac and blood parameters. If the calcium level is normal, don't do anything. But you can do one thing. Every 2 to 3 years, my advice to our senior citizens, go for a DEXA scan, which is a bone mineral density, which is done under X-ray control, where they will see, average out your calcium in 3 parts of the body, like hips, spine, and wrist, and bring out at your age what should be your calcium. I think that's the best way to go about it.
Right. Thank you. We have a question from Mr. Rajesh Gupta, who has calf muscle pain while resting and sleep. What should he do?
Yeah, this is usually a cause called lactic acid deposition occurs in glucose utilization curve cycle. If you studied science in school, because cycle ATP muscle release. ATP doesn't get released and they become lactic acid. So we have to prevent lactic acid deposition. So for that, you have to have some antioxidants like vitamin E, do regular exercises, no shortcut to exercises. Vitamin E is very important for these people who are having calf pain. And if it is persistently, then they should go for Doppler and other tests as advised by the physician.
Doctor, there's a question from Mr. Basavraj Nagashetty. He's 66. He's had undergone a TKR surgery in the left knee in Bangalore.
Yeah.
His post-surgery, he says his left knee is perfectly all right. Now I'm getting pain in the right knee. I get pain only if I walk more than 3 to 4 kilometers. Otherwise, I'm perfectly all right. He asks, can I go for knee surgery?
Answer is no. Like I explained this already. If we don't do surgeries for those people who are walking 3-4 kilometers, what will I gain out of it? No surgery, no surgery.
Right, absolutely. Thank you, doctor, for this very candid response. There is a question from Mr. Ajay Ketatpal who says, my father-in-law is 86 and having led a very active life, 72 kilos. He's diabetic, blood pressure and hypothyroid, but has generally good health. He had a fall in June 2020, which led to a fracture in the femur. Rod was inserted, but the fracture did not heal up, and he was having severe pain. Hence, had elective right leg partial hip surgery in September 2022. He needs a stick to walk, which he's not happy about, and aspires to walk without support. Your advice for him?
I got the answer for it. Mr. Ajay, it is better if he is 86 years old, he should walk with a stick, otherwise he'll break the other hip. Be careful because it is not only the bones, it is also in the brain atrophy occurs. The balance, why he fell down in first place must be lost his balance while going to toilet and other places. So I would suggest that let him continue with stick. But in case he has a pain and he is using the stick, then go to the orthopedic surgeon. They will do the x-rays because partial hip replacement we don't do anymore now for a hip fractures because the problems, it is very painful and failure rate is very high. Within 5 to 7 years, it fails. We do a total hip replacement for fracture, unless otherwise indicated. It takes hardly half an hour to 45 minutes to do a total hip replacement, most of the surgeons, because of the technology. So I think if he is having pain and he is walking with a stick and difficulty in walking, then go for surgery. Otherwise, just leave him alone.
Right, thank you. We have a question from Mr. Brijendra Kumar, who's 79. He's based in Bombay. He asks, can the drugged joint case?
No. Same thing. Joint case has got glucosamine. So I answered that question. It is just a partial relief. It's a placebo.
Right. Thank you. Dr. Will, there is a question from Madhusadan Bhandarkar. What will be the recovery time after the surgery? For how long does the patient need to undergo physiotherapy? He is 71 male. How long should painkillers be taken?
No need of painkillers. If you are taking painkillers after joint replacement, so why are you got your joint replacement done in first place? As far as recovery is concerned, I told you already, if you want to do anything, you are allowed to do everything. My patients climb 3 floors of stairs to go back home after surgery in 7 days. It depends on the technique. It depends on what implant you are using and how much is the patient motivated. I sit with the patient, motivate them. Why you want to get your joint replacement? Then I tell, okay, these are the points. You want to play golf? Okay, you can. Somebody says, I want to play single stages. I say, sorry. No replacement surgeon will allow you. If you fall, it will put stress too much on your knee. Doubles you can play. So like that, driving car. He says, can I drive car? I tell, of course you can drive. But driving a scooter, I tell no for 3 months. Because scooter in red lights, you have to stand on one leg. And you are putting your leg, body, scooter body on my knee, which I have replaced. And the ligament will become lax. So I say no. But driving car, it's fine. So these are the activities. He says, basically, he is asking, I'm 71 and how many days after walk? You can do anything you want. There is no restrictions. It is a lifetime surgery.
Doctor, 2 more questions. You mentioned about lifetime surgery. So the knee replacement lasts for the lifetime?
No.
Okay, sorry.
It's a mechanical. Nobody can be a God player. I cannot do what God has given. If you believe, just one point to be added here. When we are walking, we lift one leg in the air and the other leg is on the ground. The leg which is on the ground, the forces falling on the hip, if you are 100 kilos, you are putting 300 kilos on that hip and it withstands for 80 to 90 years. On the knee, it is 5 to 6 times and multiply by 100, 500 to 600 kilos. If you are 60 kilos, 300 kilos of load every step of 10,000 times a day, you are putting onto that. And God has created such a beautiful cartilage. Ankle, 8 to 9 times. So 1 quintal of weight you are putting if you are 100 kilos and it does not become bad. So he cannot be. It's a mechanical. It has to loosen up. It has to come out of the bone. We put a nail and leave it alone with the weight on it. You will say that nail will stay for long. It will not. It is a mechanical thing. It will loosen up. So it's chances of loosening. But then all said and done, if the technique is correct, see, it is like a wheel. Alignment and balance in the knee or any joint is most important. That God has given us. It has balanced it so beautifully. He has aligned it. You ask the architecture, they say the basement is wider than the top floor, right? Our body is like that. Our knees are bent outward 4 degrees. Our elbows are bent 4 degrees outward to accommodate our curvature in the pelvis, in the abdomen. Like that, God has given a balancing, beautiful alignments. The knee is aligned 4 degrees to the mechanical axis. The mechanical axis is center of the hip, knee and ankle should be in one line. God has created blood transmission so beautiful. And we try to create that. If that technique is followed by putting a mechanic and walking kinematic alignment, kinematic means forces on the movement, you will get a beautiful result. They will last for 25, 30 years. 10 years, if you have done a replacement, 100 out of 100 patients, their knees would last. And if you are a good surgeon, 20 years, 100 out of 100 will last. After that, it is your body and this thing percentage decreases. What we call we have a registries. Like Asia is an Asia Pacific registry. All the joints we do, they go to their data because the company is international marketing company, international company implants we use. They go into data, they analyze. The moment I change it, after 10 years, data goes again. Dr. Murthy changed this joint after 10 years. So they analyze 30 to 40 lakh joint replacement done, 4 to 5 million of joints done in a year in Asia Pacific area. They give the results. And we say that 25% years is the 85% to 90% survivability. That means 90% of people will have their joints in 25, 30 years.
Doctor, one last question, which is there, is I know it's an unfair question to ask, but still, Dr. Sheila Kohli asks, what would be the cost of knee surgery these days?
See, government has regulated the implant price, which is a very good thing also, bad thing also. But good thing is that patients are getting benefits. If at all, the doctors are, not doctors, the corporate hospitals are passing the benefit to the patient. Some, it's like varies from place to place, cost of living, cost of these things and all, and cost of expenditure of the hospital infrastructures, which we call overhead charges. So it depends from place to place. I can't exactly say what is the cost in Bombay and Bangalore and Delhi. Delhi, we know average is that most of the hospital charge around 5 to 6 lakhs within that range, depending on the which tier, like 5-star hotel you stay, you pay 30,000 rupees, and in a single-star hotel, you pay 10,000 rupees. So the cost overheads are very high for 5-star hospitals. But then it's usually is 5 to 6 lakhs for both the knees in one sitting. And one knee usually is 2.5, 2.2 to 3. Narayana Healthcare is a Devi Setty's hospital brainchild. And he has instructed to all that healthcare should be for all at an affordable price. And that is one brilliant dialogue that we like to follow. So our cost is the lowest. And in fact, for cash patients, because packages are fixed by the insurance companies and government, we can't change that. It is the cash patient. So I have been instructed that if you are a very poor patient, rickshawala or anybody comes, do it in 1 rupee. We will support you. But then all said and done, I have a knee clinic package. Certain periods where the patients need to get it done. He is a middle class. So I do at around 3.99 both the knees for those people with an imported implant. and maybe little more for the better quality implant. But 3,99,000 is my package during certain periods where they have a window of period. They have allowed me to do as many surgeries at this package. For single knee, it is 2.25, 2.2, 2.2 for single knee.
Doctor, you have been amazingly candid. We've had many doctors in the past.
Yeah, I know I'm talking to a journalist, but it is a fact. And most of because hospital have got to pay tax. 1 month, one Narayana Healthcare hospital per a month, electricity bill comes to 3 crores. Water comes to 2 crores. If you consider the finances, the overhead charges are very high. Hospital industry is the lowest earning industry. It gets 7 to 10% EBITDA per month.
Absolutely, doctor. Thank you very much for
we
being
charge
here.
a lot. Doctors don't charge. It is we are given salary for us.
Right. Thank you, doctor, very much for being here. Doctor, if you don't mind, there's a question from somebody who comes regularly, Mr. Suresh Ghate, his wife is 65. The X-ray report says osteo.
Yeah, but little high thyroid when walking, trembling is surgery required. Surgery for what?
Is surgery required for the knees? He says because for
is written at knee.
He's not written for knees, but
let's consider the knee. See, osteoporosis and osteoarthritis are two different issues altogether. Osteoporosis is lack of bone mass, including calcium mass, as well as proteins and other minerals is osteoporosis. Osteoporosis is not only lack of calcium. It has got to be osteomalacia, rickets is lack of calcium. So that is one situation. Osteoporosis is not diagnosed in the X-ray because nowadays we do digital X-ray where you can darken and lighten. It will look very osteoporotic. Go for bone density, ma'am. 66 years, go for bone density. Estimate your blood calcium and vitamin D level. Then go for treatment of osteoporosis. Surgery in osteoporosis, I have a good publication. You can go through that. Where I've done in severe osteoporosis, where I could press my fingers on the bone and the bone is to get dent. Those cases, I got a lot of precautions we take, and it is possible to do it, and it can be done. Surgery for osteoporosis in osteoarthritis with osteoporosis can be done.
Sorry, doctor, you mentioned about a publication.
Yeah.
What is, which one is that?
It is a joint replacement in osteoporosis.
You've written a book?
Not a book, it's an article. I presented it in Leeds, UK, 4 years back.
So you can Google for the thing and perhaps look at it. To all of you over here, it's been amazing to have Dr. Murthy here. And this session, the recording of this session will be there on the Seniors Today website, as well as takeaways, which is written by a medical practitioner. And this will be there on the website on Monday evening. So you can have a look at that. Some of the points that Doctor made, you may not have made notes of it, but you can look at the presentation once again and enrich yourself. We will be back once again next week. Next week is a session on Ayurveda, which is a sponsored session, and we'll be back again. I will be back again on the 23rd. And to all of you here, if you want to pre-register for the health webinar sessions, you can be there. The link is there in the chat window. Also download the Evergreen Club app. You can participate in our various events, and we're going to be starting training programs very soon. Enjoy yourself on the Seniors Have Talent, which is on Wednesday evenings. There's a finale coming up on Jan 7th, and so on and so forth. And once again, I must thank Dr. B.S. Murthy for being here and the team at the Narayana Healthcare for facilitating this. Thank you very much, Doctor. Thank you.
Bye-bye.
Subscribe now and press the bell icon. Never miss an update.